honourable member for Beaches East York, and I should let him know ahead of time that I'll have to interrupt him at 2:15.
At 2:15. Thank you, Madam Speaker. Madam Speaker, I'm rising today in support of motion 319, but I must tell you, Madam Speaker, and tell my colleague from Ottawa Orleans that my support for this motion is tepid. It's tepid because the motion itself is tepid. I support the motion only because it's better than nothing else, and the issue of childhood obesity requires a response, and an urgent one at that. Knowledge of something that creates harm, Madam Speaker, creates an onus on us to respond. That's not just a principle of health promotion or disease prevention, it's just a principle. And it is a principle from which we cannot waver, a principle that is imperative to follow. When those who are being harmed are unable to protect themselves, such as this case, the case of childhood obesity, it is of critical importance. So here's what we know. We know that childhood obesity is an enormous problem. As of 2007-2008, data indicates that 1 in 4 Canadian adults were obese. 60% of adults were overweight or obese. That's 14.1 million Canadians, Madam Speaker. Overall, 26% of kids ages 2 to 17 are overweight or obese. Childhood obesity rates have nearly quadrupled in the past 3 decades, and the rate of obesity amongst Aboriginal children is significantly higher than it is for others. We know also that obesity in children and adults impairs health in some very serious ways. It has been suggested that 90% of type 2 diabetes, 80% of coronary disease, and 1/3 of cancers could be prevented by healthy eating, regular exercise, and non-smoking. It has been estimated that health costs most consistently linked to obesity is about $4.6 to $7.1 billion annually, and those costs represent an enormous increase of estimates of just a decade earlier. And most shockingly and importantly, Madam Speaker, it's estimated that as many as 48,000 deaths per year in Canada are related to poor nutrition. Here, Madam Speaker, is the disappointing and disheartening, if not outright tragic thing about what we know. We've known this for a long time. In 2007, the Standing Committee on Health presented its report entitled Healthy Weights for Healthy Kids. It was a report about this very subject, childhood obesity. That report begins with this very clear statement, and I quote, "Childhood obesity has become an epidemic in Canada." In response to the question, how serious is the problem, the report says, the committee was shocked to hear how much overweight and obesity rates among children and adolescents in Canada have increased over the past 3 decades. It goes on, the situation for Aboriginal children is the most alarming. What followed, Madam Speaker, was a list of 13 recommendations. They talked about establishing targets, establishing a comprehensive public awareness and promotional campaign. That's obviously useful. Implementing mandatory, standardized, simple front-of-package labeling about nutritional values on foods. Establishing regulations limiting trans fats. Collecting data. Creating knowledge exchange. Creating a research capacity and a research focus on the issue of childhood obesity. Leadership mechanisms were included, federal leadership, Madam Speaker, of all things, assessment and reporting, evaluation, and establishment of a reliable baseline to assist in both research and management of this process, and also the provision of standards and programs. And so, very importantly, Madam Speaker, funding. The final recommendation called for new and dedicated infrastructure funding to facilitate access to varied options for children with respect to quality physical activity and healthy food choices, and all of this to be done in collaboration with provincial and territorial partners. Madam Speaker, such a sensible response to such a critical problem, but what happened? I'm the father of 3 kids, Madam Speaker. I used to be an attentive father before I got elected to this place, but I still do most of the family shopping when I'm home on weekends. And Madam Speaker, if we were making progress on these recommendations, I dare say, as a father, I'd know about it. But it has eluded us, Madam Speaker. All we hear about are programs, et cetera, in speeches from folks on the other side of this place. The recommendations of that committee, Madam Speaker, have not been acted upon, certainly not in any discernible, meaningful way. Now, I know the government has been involved in creating the Declaration on Prevention and Promotion of Curbing Childhood Obesity, But, Madam Speaker, what is incumbent on us is action. And, you know, I heard my colleague from Ottawa Orleans respond to a question earlier in this House that he always responds first with pedagogy. Madam Speaker, an important component without question, but hardly a substitute for action. Action based on the kinds of rigorous principles expressed in those 2007 report recommendations. The kind of action that this motion contemplates, Madam Speaker, does not at all reflect the serious nature of this issue, nor the full knowledge that we have of both the causes and outcomes, both health and financial, of childhood obesity. In this motion, my colleague proposes to continue dialogue, to encourage discussion, to encourage individuals and organizations, and to consider. Hardly an adequate response, Madam Speaker, hardly a principled response in light of what we know about childhood obesity and its impacts on children and our healthcare system. And so, Madam Speaker, the NDP has made a call for action. It has consistently called for regulations on trans fats and foods to reduce the contribution to the poor diet and to childhood obesity. A colleague of mine from the NDP caucus has introduced previously a private member's motion to regulate the level of trans fat foods. The NDP has consistently questioned the health minister about regulation of processed foods, including why the minister cancelled the plan to lower trans fat foods and why the minister has not listened to the call to lower sodium in foods. Madam Speaker, we've heard today from the other side a lot about programs and steps and so on. But as I mentioned before, I'm a father to 3 kids, and it's important to this debate today, Madam Speaker, because if meaningful action was taking place on childhood obesity, because if it was real, Madam Speaker, I would know about it as a parent. Thank you very much, Madam Speaker.